do get asked that question all the time. And I think people tend to think global health is I leave Canada, go somewhere else, practice there, and then come back and practice here. Two separate jobs, two separate entities. But I think they're very interconnected and very related. And I think global health really is just treating an entire patient, no matter where they are. That goes beyond just their medical condition. It goes into their barriers to healthcare, their socioeconomic status, their social determinants of health, and all those kind of things. So I think global health really is an all-encompassing term for being a very well-rounded physician, no matter where you are. 10 years ago, we talked a lot about international health, and that did very much relate to people traveling overseas, doing stuff overseas, and coming home. But I think as the field has grown over the past decade, it's become more all-encompassing. And I think it's because the people that do go overseas also tend to work with marginalized populations back home as well, refugees, homelessness, that type of stuff. So I think it's the same group of people who now think that it's not just happening overseas, it's happening in Canada, anywhere, really. I mean, I think it makes me a better physician. Certainly, I don't know if I'm actually helping anybody more than anyone else. I certainly don't know whether I'm making a difference overseas, but it certainly makes me a more humble physician, I think. I think it makes me a little bit more able to think on my feet and use my hands, as opposed to relying on technology. But I truly believe that I gain way more out of this than I'm able to give. I really believe that people should, in training programs, take this as an opportunity to learn about another culture, to learn about another population, whether it's in Canada or abroad, and not to have any kind of preconceived notions that you're going to make a massive difference right now. But it's all about going places, forming relationships, getting to know a community, getting to know a culture, becoming invested in that place, and then eventually maybe you will make a difference. So that's kind of what I'm doing in Namibia and Uganda, two places that I've built connections, built relationships, and over time we can see change happen. But going on an elective for 2 weeks should really be about you learning and observing and not attempting to impose your Western views of medicine on another culture. The absolute sheer poverty that some people live in. I don't think that ever, you never get used to that. So you never get used to seeing malnourishment. You never get used to seeing people living in absolutely nothing. So that still surprises me a decade later. And then it surprises me when you come home about how unhappy we are with all the stuff that we have. And I know that sounds kind of cliche, but the happiest people I've met have been the people with the least in terms of things and stuff. Almost every medical school allows residents to go overseas on an elective with varying amounts of supervision. Almost every internal medicine program that I know of, and many programs have formed these collaborations and these relationships. And I know that global health is certainly something that a lot of academic institutions are thinking of. So there usually are people in their university that they can speak to. There's a lot of universities even have a global health office or department where people can get linked up with.